Developing advanced patient-specific in silico models, a new era in biomechanical analysis of tooth transplant autotransplantation. A Belgium group have issued and pioneered this methodology in which they study the function of teeth subject to autotransplantation and being able to study the stress and the biomechanics in relation to patient-specific properties. As we all know, the recent advancement in precision and personalized medicine have enabled clinicians to transition from conventional autotransplantation to a CBCT-guided approach, and this led to many advances in the field. So the idea or the new thing that comprehensive research in biomechanical responses of these teeth following the autotransplantation has not been sufficiently studied. So the aim of this technique or methodology is to bridge the divide between advanced tools and their practical implementation in patient care. Finite element analysis or finite element models have been used recently and proven to be highly effective in studying and predicting the complex biomechanical phenomena. This study was aimed to develop, apply accurate patient-specific in silico modeling to investigate the influence of oral biomechanics on tooth autotransplantation outcome, which hasn't been done so far. They included 6 patients, which met the inclusion criteria of being less than 15 years of age, auto-transplanted premolar to a central incisor recipient site, and they had a preoperative and they had a post-operative CBCT after 1 year available. They used a desk software and an abacus software where the nodal zygomatic process were constrained to prevent displacement of the finite element model. And they studied 2 clinical situations, physiologic mastication and dental trauma. And they had a given force applied to the transplanted tooth donor as well as the contralateral, which served as a control. They had T1 models and T2 models, one for the control, one for the auto-transplanted tooth. So discussing the results, there was a heterogeneity in stress distribution post autotransplantation, particularly in contrast to control incisors, which accentuate the involutic biomechanical responses dictated by factors such as root configuration and crown morphology. And interestingly, the stress distribution was mainly in the apical and lateral sides of the PDL, which seemed to play a crucial protective role in enabling homogeneous transmission of occlusal forces. However, for trauma, stress values were lower after root maturation at follow-up compared to at the day of surgery, which confirms the conclusions in the literature that the frequency of cervical dental fracture based on root of development, the highest decreases in stress values were reported for teeth presenting the highest root development. This is an interesting approach which offers a significant advancement in understanding patient-specific biological response. It demonstrates effectiveness in revealing biomechanical variations due to individual anatomical and tissue differences. It is very interesting to be able to see what is the possible fate of this transplanted tooth in each specific patient, and to see how it would accept it in terms of occlusion, what type of occlusion is this tooth going to exert, and what type of occlusion can it withstand, and also the stresses that are distributed to each tooth, which would be interesting to be implemented in an actual surgery, and it would give the clinician the idea to have to be able to predict the outcome of this procedure. Thank you for listening.